An addiction medicine specialist at Mayo Clinic, Arizona, is out with a new book that goes beyond the science of addiction to help those struggling with opioids. The book is titled Ending the Crisis, Mayo Clinic's Guide to Opioid Addiction and Safe Opioid Use. There it is. And here's the author. She's Dr. Holly Geyer from Mayo Clinic, Arizona. Welcome to Arizona. Welcome back to Arizona Horizon. Good to see you.
Thanks for having me on.
All right, Ending the Crisis, Mayo Clinic's Guide to Opioid Addiction and Safe Opioid Use. It's a long title, but there's a lot of meaning in that. Talk to us about that.
We tried to shorten the title, and you know what? To get at the heart of the message of what we wanted in this book, it had to be that long. Really, the purpose of this book is to help people understand when, how, why we use opioids, and to take them on that journey as patients, not necessarily just as individuals understanding the national crisis we're still in, but as patients who are going to receive these drugs at some point in their lifetime for pain management. There's a good reason to use them, but we differentiate when and why.
What do we know about opioids and opioid addiction?
Well, we understand right off the bat that we are still in a national crisis on this topic. Opioids themselves still drive the #1 cause of death in adults under age 45. They've reduced our average American life expectancy. It's a mess out there. 1 every 5 minutes out there is dying from this drug class. So if I were the FDA, if I was another field of medicine, I'd say get rid of them. But the problem is they serve a purpose. They are the most reliable medication we use for pain control for moderate to severe pain. And when we use it in the right patient, at the right dose, for the right length of treatment, via the right route, they're medical cures.
I was going to say, you have positive results with opioids. It's not like opioids are out there, a street drug that no one wants to touch. I mean, they do serve a purpose.
Absolutely. We need them. We just have to do it safely.
What do we not know about opioids and opioid addiction?
What we don't know is that any of us, and all of us, are susceptible to their secondary consequences. The American Medical Association estimates that between 3 to 19% of people that ever touch that drug class will develop long-term dependency. And so short-term prescriptions can still cause consequences. This is why we say use it when needed, only as breakthrough in very specific circumstances under a prescriber.
Do we know why they cause consequences for some folks and not necessarily as easily for others?
If I had that answer,
yeah.
I wouldn't have a job. The reality is that we don't know. We're still investigating. We think that there's partial genetics, partial mental health component, partial psychological, societal components that all come together and create that perfect storm for a person. But everyone is at risk the moment they encounter that drug class.
And they're at risk because they get caught. They get caught up
Bingo.
in it. How do they get caught up in it? Is it just basically, it just makes me feel better?
Not necessarily. We really recognize 3 major pathways to the development of addiction. So there's the common one you and I are talking about now. That's that pain management, where recurrent exposure to the opioid drug class day after day, hour after hour, starts to cause changes in the brain. These people may not experience euphoria or that high, but with chronic exposure over time, that brain change takes place to the point we call it addiction. And that's one route. The other route is the more common one we see with kids, right? The ones you're out playing, you want social acceptance, there's euphoria, that profound high. Those groups, again, through recurrent exposure, are on a pathway. And then the final one that we see is that group, mostly through COVID over the last couple of years that's grown, with mental health issues, depression, anxiety. These drugs cure all of that temporarily until they become the problem.
Yeah.
All roads lead to problems.
Yeah, they cure it until they don't.
Bingo.
The book contains what is described as practical tools for recovery. Things like interventions. What are we talking about here? Practical tools for recovery.
Absolutely. It's the mindset change. If we look at the opioid crisis, you go all the way back to the late 90s until those probably 2010 era. Opioids were the go-to drug class when you had pain. Prescribers would offer them from everything from hangnails to general surgery. And the reality is we've learned so much more. The point of opioids is not elimination of pain. It's to help you become more functional so you can perform activities of daily living to recover. We need that mindset change.
I was going to say that's really important because you don't hear that enough. I think people take pain medication to get rid of the pain, zero it out, and you're saying not so fast.
Absolutely, and there is always a role for adjunctive, non-opioid integrative mechanisms, right? So either non-pharmacologic treatments or scheduling Tylenol or ibuprofen along with opioids for breakthrough.
What about holistic methods. Where does that play into all this?
I can tell you, when I started this journey in the world of addiction medicine, I looked at it from the side and gave it an awkward stare, and I have learned so much more. There is a role, especially when stacked together. Things like physical therapy, occupational therapy, Tai Chi, yoga, all have benefits, and they can help reduce the amount of opioids consumed.
The book includes a lot of stories regarding folks who've had issues and worked on them. What kind of response have you had from folks who read the book and from folks who have managed to get out from under this?
Finally, validation. What you'll see in this book is that the first half is really making the argumentative case against reliability of opioids as that first-line agent, and really helping people understand how chronic pain is a different beast and why we don't use opioids in general for that grouping. The second half of the book is all about managing its consequences, including addiction, and there's such misunderstandings about the use of medications for opioid use disorder like buprenorphine, methadone, and naltrexone. We take them on that journey. People who read this book finally feel like they are understood.
It sounds like you're very passionate about this. Why are you so passionate about this?
I grew up in the addiction treatment field. My parents had started a program when I was a little kid, and it grew to a very large one. I grew up hearing these stories, and no one is immune from them. We've had senators' kids all the way to people who grew up on the streets who've walked this life of addiction. It's the great destroyer.
And those stories never change, do they? They're all relatively similar.
Absolutely, every one of them. When we understand the biology that drives addiction, we start understanding it as a disease, and that's where our empathy as family, friends comes in to help support people through it, not ostracize.
Dr. Holly Guyer, again, Mayo Clinic, Ending the Crisis, Mayo Clinic's Guide to Opioid Addiction and Safe Opioid Use.
You nailed it.
Congratulations, and thanks so much for joining us.
Thank you.